Welcome to Family Health by Mini First Aid. Mini First Aid are the UK's leading family first aid provider, and we are delighted to bring our latest podcast series to you, giving you all the information that you need around family health subjects. Thanks for joining. Welcome to the Family Health Podcast. This podcast is brought to you by Unity Mutual, a trusted partner for your savings and investments and partner that understands your commitment to your child's health and financial future. When you choose Unity Mutual for a junior individual savings account, you secure your child's savings journey and receive a free mini first aid class. But it's not just about caring for their health, it's also about setting them up for a brighter future. Unity Mutual believes in enriching lives beyond pounds and pence, empowering you with both financial stability and life-enhancing opportunities. Let's dive in. Hello and welcome. I'm Kate. I'm the founder of Mini First Aid, and welcome to our podcast, Family Health by Mini First Aid. I am absolutely thrilled that you've decided to join us for Series 2 of our podcast, where we're going to continue to bring you top family health advice from leading experts. And talking of leading experts, I'm delighted to introduce my guest today. Marisa Russell is actually one of our Mini First Aid trainers, but she's also a dental nurse and has come to talk all about, in particular, children's dentistry with us today. So welcome to the podcast, Marisa.
Hello, thank you for having me.
That's all right. Marisa, I've given you a little bit of an introduction there, but tell everybody a little bit about yourself and what do you do?
So I am a qualified and registered dental nurse. I qualified way back in the depths of 2003, which feels like an awful long time ago now. Currently I work with a dental nurse training provider, so I'm the course coordinator for them. Mm-hmm. There go my teeth, we spoke about those. And I am a trainer for Mini First Aid Sussex as well.
Oh, that's brilliant. So you're actually training people that are coming to work as dental nurses in the dental profession?
Yes. So they join us, they complete their course with us. It's 12 months to 18 months course, and then they then go on to qualify as dental nurses.
Oh, fantastic. I'm eager to know, right, what's happening in dental care in the UK at the moment? It seems like all the time people are saying they can't get appointments, people reporting having to pull out their own teeth because they can't see a dentist. What's going on in the world of dentistry?
Yeah, it's all a bit of a mess, isn't it? So what we're seeing is it's not necessarily that there's not enough dentists left. What we're seeing is there's not enough dentists, or it's perceived as not enough dentists working in the national health system.
Right, okay.
And this is because a while ago, and it was a while ago, it's not a recent thing, the way dentists are paid through the national health system changed. So previously they were paid per item. So if they did 3 fillings, they'd get paid to do 3 fillings. But this system changed and now everything is grouped into bands. So for example, if I went to the dentist, had my examination, some radiographs, so some x-rays, and a filling, the dentist would receive a set amount for that. But for example, Kate, if you went, I'm using you as an example here. Sorry,
that's fine. You can use my teeth. I shall grin if you're watching me on YouTube.
But if you went to the dentist, for example, and were told you needed that checkup, which you had, but then you needed something a bit more extensive. So perhaps, whereas I had a filling, perhaps, but you had multiple fillings, the dentist is still given the same amount to do that. So the resources, what's used is much higher, but the cost to the dentist or the fee that they receive is the same. So this has seen a lot of dentists say, well, actually, I'm not getting what I need from the health system, the National Health Service. My resources, my cost of staff, and, we're in a cost of living crisis, let's face it, is going up. And actually it's not what I want. So a lot of them are now reverting or moving over to private dentistry. So
what does that mean for the state of the UK's health dentistry then? Because presumably not everybody can afford to see a private dentist.
Exactly that. So not only is it very hard to locate a dentist still working on the health system, we know a lot of people now are simply not going, because they look at the cost of private dentistry and just think to themselves, I can't afford that, and perhaps do not prioritise oral health over other things like feeding themselves, electricity, and obviously coming into the winter, our heating and things as well.
Oh my gosh, it's a minefield. So, okay, so just for the purposes of assumption here, let's assume that you can access a dentist. How often should we be going? And is it different for children and for adults?
So how often should we see a dentist? That's a conversation that will be had between you and your dentist, although we do follow NICE guidelines. So certainly for those under 18, there is guidelines with regards to how long or how often they should be seen. It certainly shouldn't be any longer than a year. Generally we find for children, the under 18s, it's 6 monthly. That is the general requirement. For us as adults, we shouldn't really go any longer than 2 years, but you will find that your dentist will likely recommend either 6 months or a year, because not only are they checking our teeth, we're looking at oral health in general, and obviously looking at those factors, if somebody perhaps smokes, drinks alcohol, those kind of things, they're at higher risk for things such as oral cancers. So it's really important they are seen regularly to monitor those and perhaps detect those early signs if needed.
Yeah, in fact, I know of stories where it's the dentist that has picked up oral cancer and has actually done the referral. So having that regular checkup is still really important, therefore, for everything that's going on in your mouth, as well as your teeth as well. I want to talk to you about children. I'm a mum of 6, so we probably should have bought our own dental practice, or certainly taken out shares. But just for parents and carers listening, particularly, and they're thinking about their children's teeth, what's the most common problems that you as a dental nurse and the dentist see with children's teeth? What's most common?
Tooth decay.
Tooth decay, okay.
Yeah, so we know that the number one reason in the UK for children being admitted to hospital is tooth extraction, or in some cases multiple teeth extraction. We know there's a vast number of under 5s that actually attend hospital to have full clearance. That is every single tooth removed from their mouth.
And why do they need to have them taken out?
Because of the level of decay. So if we're not careful about what we're eating, what we're drinking, or our children in particular, what they're eating, drinking, snacking on, if we're not promoting good oral health habits, tooth decay will form. We'll end up in situations perhaps where that decay goes down to the nerve of the teeth. That's when we end up with abscesses and things like that. So yeah, it's really shocking to think that we're in this position.
So if you have a child with a decayed baby tooth, their first tooth, that could then impact the adult tooth that's sitting in the bed of their gums as well, is that right?
Yeah.
And that's why they need to come out.
Yes. Yeah, absolutely. Yeah. And there's a pain associated with that as well, and we don't want to leave little people in pain.
Okay, and what are the symptoms then? So there is pain. How on earth do you know if your child has got decay?
In most cases, it's quite obvious. They're brown marks on the teeth that you'll be able to see. Obviously, further back in the mouth, slightly more difficult to see. But again, that's why those regular checkups are really important, so that the dentist can see and have a really good look round. Yeah,
I feel like it's a confessional now, but one of my children at age four, the dentist found some decay in one of her back teeth. And we had to have a filling, so it wasn't removed. Why would sometimes you have to have a filling as opposed to the tooth removed? What's the difference?
Again, it will all come down to access. So if, for example, they've been left and that decay has been left to literally go through the tooth, because it will just spread through the tooth, and if that's affected the nerve of the tooth, so that becomes inflamed, and then we end up with an abscess at the end, it's likely that they'll remove that. There is a course of treatment that you can follow for that. but generally we find, and especially in poorer areas, so areas that we know are, dealing with poverty, that this occurs, that they will just go for the clearance.
The clearance. Oh my gosh, that sounds so drastic. I remember thinking I was mortified because I get my kids to clean their teeth, and I was mortified. And I had a conversation with the dentist about food and drink and habits of food and drink. Talk to me about then. So we'll talk about toothbrushing in a minute, but let's talk about diet. Talk to me about this snacking that you've mentioned and food that children have and how they can cause decay in their teeth then.
Well, as you know, I've got a nearly 5-year-old. Isn't it difficult to manage their snacking?
Ridiculous. And they want to eat all the time.
Yes, they do.
They're always hungry.
Yeah. So we know that when we eat, in the mouth, the pH levels in our mouth change. We might end up with acid, and acid will attack our teeth. So it's really about frequency of snacking and what they're snacking on. Now, the danger is that we go, fruit's really healthy, but actually if we're handing them an acidic fruit, such as orange, or satsumas, things like that, we're probably adding a little bit more to the problem than we need to. So if we are looking at fruits as healthy snacks, something like apples or pears are better down that route. Parents get tricked by a lot of marketing. Look at these lovely little snack boxes of raisins. Raisins are absolutely terrible for teeth, because quite a lot of the time they'll actually get stuck to the tooth, and all the time they're in contact with the tooth, they're causing this reaction. So better things to look at are things like cheese, and raw vegetables. And even yogurts. But with all of these things, again, a healthy diet, we've got to think about cholesterol, fats and all these kind of things. It's very difficult to find the right balance, and as a parent, that's, can be quite, you can end up almost overthinking it in a lot of cases. But when it comes to all health, something not non-acidic or minimal acid, and as low in sugar as possible. So yogurt is great, but what yogurt? A lot of kids' yogurts, bright and cheerful and whatever, but actually when you look at the sugar content, it's quite high. So natural yogurt, for example, is a nice snack. Not that they really fancy natural yogurt. Can you do natural yogurt with a honey in or a crushed fruit or something in it? Would that work as long as you were watching the sugar? So honey again is naturally quite sweet. Okay. Probably would avoid that. Fruit, absolutely fine, but we do know that when we treat fruit in certain ways, so for example, if we whiz it up in a blender, we release the natural sugars in it, which also can be an issue. So better to have the fruit almost whole. And so, I love natural yogurt and banana as a snack. I think that's a great little snack to have, or natural yogurt and perhaps an apple. Apples and peanut butter are great, as long as you're buying peanut butter that's not got added sugar in, things like that. And again, as I say, cheese is quite a nice option as well. So I guess perhaps naively thought, as long as I'm not giving my kids loads of sweets, then I'm all right. And sometimes I might be in the supermarket and feel like I'm being a good parent because I'm buying these the fruit bars, or the bars that are like it looks like a sweetie, but they tell you it's 100% apple, and it's sort of been treated in some way that makes it like a gooey gummy line or little disc or something that you can eat. Are they just a no-go, or what are your thoughts on those? Do they have a high sugar content then still? Everything in moderation. Everything in moderation, as with anything in life. But when you are looking at the frequency of the snacks, and we know with young people, with these little ones, they just want to snack all the time. So we've really got to be aware. I don't ever say that anything's a no-go. My little boy loves a pack of Smarties on the way home on a Friday from school, but that's our treat. That's how we've done it. That is a treat. yeah, some of these things we know are packaged as, oh, this is really healthy, this will be really good for your children, but actually when we look at it in detail, there are a lot of hidden sugars. There was a massive thing recently about baby food in the market, and actually how much hidden sugars there are in baby food. And sugar does hide everywhere, and it's not obvious. So like you say, you obviously think about sweets, chocolate. Yeah, you know, those are your natural go-to when somebody says to you, where do I find sugar? But what about things like tomato ketchup, like chicken nuggets, like bolognese sauces? If you actually read the label for some of these things, you'll find sugar in them. Now, not all of them are going to be high sugar content, but why should they have sugar in them at all? You know, we can make these things from scratch without sugar. So it's really, I find it really, and I find I have an added pressure as a dental nurse because I feel like if my child gets decay,
we're in trouble. If it happens to the dental nurse, we're in trouble.
I can't get it right, you know. And I did recently have to take him to the dentist because there was a small shadow on his tooth, and I was looking and I was thinking, what is that? But it's actually just natural tooth translucency. But yeah, and of course I'm paranoid as well. I get really paranoid about it. But, you know, it's really fascinating when we delve into it properly where all the sugar is hiding.
I was asked,
just a minefield.
I was asked by my dentist to keep a little diary of my daughter's diet just so that they could point out where the sugar was. And the bit of advice I had was just in general that snacking needed to be reduced, that we needed to aim more for solid meals, bigger meals maybe to fill them up, but actually less of there's always this constant snack. Would that be your advice as well, Marisa?
Yeah, so generally, because we know whenever we eat, we're causing acid attacks in the mouth, we want to consolidate those times. So solid meal times, you know, 3 meals a day, you know, and keep everything within that meal time. So if they are going to have a carbonated drink or a fruit juice, have it at the same time as the meal. If they are going to have that little sweet treat, best to have it with the meal so that the attack only lasts in that period. And then it's over and done with until the next time. The issue we have is where somebody is snacking, where they're continuously putting those effects onto the teeth, and then you've got this continual... The mouth doesn't get time to recover from it, and that's where we do really see an issue.
Right, so meal times, less snacking, better snacks, less sugary snacks. Interesting what you said about Satsuma. I have a Satsuma addict as one of my children. I should be addressing that issue when I get home this evening. Let's talk about toothbrushing then, because with children, what's your recommendation for brushing teeth?
Let's be supervising them up to around 7 or 8 years of age, you know, depending on how mature they are. Because although they want to think they are independent, they know it all. My little nearly 5-year-old wanders into school every morning now, dressed slightly back to front some mornings, I might admit, shoes on the wrong feet, that kind of thing. But mummy, I did it myself. They may not be getting to all of the areas of the mouth. So my advice for brushing is make sure we're using a good fluoride toothpaste, and you know, we're looking at about 1,000 parts per million fluoride for that younger age group. Twice a day, 2 minutes. If we're letting them do it themselves, absolutely fine, but then go back in afterwards and do it again for them. You know, there's going to be some protesting to this. We'll frame it politely, protesting. But things like light up toothbrushes, musical toothbrushes, they're all out there on the market for us to enjoy. I always encourage the use of a timer.
Yes, we've got a timer.
Quite often I get, I'm done, mummy. And, you know, I'm like, no, kid, you're not. So out comes the timer. And we both, and you know, I brush my teeth at the same time for encouragement, and we'll both stand there and do it for 2 minutes on the timer. So, you know, and by doing it with them as well, you're kind of displaying those healthy habits.
You talked about fluoride levels in toothpaste and some parts per million, and I nodded, but I don't really know what you're talking about, so I'm going to get you to explain. Can you give your kids adult toothpaste, or do you have to buy the stuff that says kids on it, or child, or has a character on it? What's the drill? What do we have to do?
At certain age groups, we can over fluoridate them.
Okay.
So it is better to stick to a kid's toothpaste as long as that is working in the right range. But generally, for children, around 1,000 parts per million, and then as we get into adulthood, it becomes 1,350, I believe it is, parts per million. Obviously, children's toothpaste are a lot more attractive to them, so that's really the vibe we're going for, because there are children out there that just refuse to do it, and it's really important. And also, they do come in generally, I know you can get adult toothpaste in other flavours as well, but kids' toothpaste, less mint, more strawberry. My little one absolutely refuses to use mint, hates it, will not engage with mint toothpaste, so we're on the strawberry. But yeah, look at it in detail and just make sure that you're happy with the fluoride content, because we know fluoride is really important for the enamel on our teeth, the enamel on our teeth, and promoting fighting against those acid attacks.
So if I get on my holiday and I realise that I've forgotten to pack the children's toothpaste and I've only bought mine, can I let my children use my toothpaste? What do I have to do?
Yeah, absolutely. Just be aware of the portion size, so to speak. So just a very, very small amount for them is
just a small amount.
Yeah.
Okay. And what do you think about electric toothbrushes for children?
Electric toothbrushes, you cannot go wrong with an electric toothbrush.
Brilliant.
We, as dental professionals, we encourage really healthy oral health habits from being really young, and electric toothbrush is a great way to get into that. And again, there's lots of children's ones out there. In fact, a lot of the children's ones are battery operated, which aren't quite as good, in that when they start to lose their power, they perhaps don't move as fast and that kind of thing. So by all means, get them ahead for your own electric toothpaste. They've all got interchangeable heads, so they're really great to use. And it is encouraged. We are encouraged to encourage people to floss their children's teeth from quite young as well, and get them into that kind of habit. Not always easy.
No, okay. And is that something you'd need to take advice on from your dentist or your dental nurse? Because I wouldn't know where to begin to start trying to get my small children to floss their teeth. Yeah.
And it's not something we see happen very often, but do definitely speak to your dentist and say, look, should I be flossing their teeth at this stage? Is it, can you perhaps show them how it's best to be done? But ultimately, as I say, when they're that bit older and a bit more responsible and got a bit more idea and dexterity in the hands and things like that, it might be something you're having to do for them.
Marisa, prior to this podcast, a while back, you and I were talking about babies and dental health for babies. So if there are people listening that are pregnant, or perhaps have just got a baby and they're thinking, my baby hasn't got any teeth yet, so I'm maybe not going to listen to this whole podcast. I hope you're still listening. What would you want to say? What's your advice for parents with babies with no teeth?
So if we were talking baby outside of tummy, so baby is born, no teeth, their gum health is still really important. Milk will always leave traces behind on the gums, and this can affect the formation of the teeth underneath. It's been shown to affect the formation. So we do recommend wiping the gums. This might be a soft like cloth, but you can buy gum wipes from some companies marketed particularly for this use. But yeah, traces of milk left in the mouth can still cause damage. So it's worth being aware of and perhaps wiping around after each feed.
Wow. And should you then start a teeth cleaning regime as soon as there's some teeth?
Yes.
Okay.
And they should go to the dentist as soon as that first tooth is through. Now, we do know that some dentists will say, oh no, we don't see them until they're 2 or 3. But the general advice is, as soon as there's teeth coming through, that's when you book your first dental visit.
Okay. Marisa, this is fascinating, and whilst so that we're going for all of the family, I want to go back up the other scale of children. So when children are developing their adult teeth, so just to use my family as an example, my pre-teenage children are rapidly losing their baby teeth at a rate of knots. It's costing the tooth fairy a small fortune. And their adult teeth are coming, and I am paranoid because now I know this is their teeth, right? These are the teeth that they have for the rest of their lives. What's your advice for that sort of age group demographic where they're starting to look after their teeth independently?
So if we're past the stage where we're supervising their brushing, we just, although they're like, no, not having you in the bathroom with me, let's just make sure they are doing things as they should. So let's encourage that full 2 minutes of brushing twice a day. Let's encourage the healthy eating habits. Let's encourage the interdental cleaning. So that might be floss, although there's some really handy little brushes on the market and things now that you can use, and that kind of thing. And it's just all about having that conversation with them and making them aware that if they don't what will happen if they don't stick to these habits. You're looking at varying levels of gum disease, bad breath. Nobody wants to be told that they've got bad breath, that kind of thing. And just, making sure that they've got the tools that they need as well. So, like you said, electric versus manual, both are perfectly adequate when it comes to teeth cleaning, but making sure they've got those tools available to them, and that they're encouraged to use them as they should.
Okay, and have you got any horror stories that I can tell my kids just to make sure that they do it? Is there any cases that you've seen that you can share?
In fact, a lot of my horror stories actually relate to what people have been eating and drinking.
Okay,
so
go for it.
I do remember, this was very, very early in my career, so this would have been way back in the early 2000s. This was an adult patient, had to come in and have a full mouth clearance, so every tooth extracted, because he had an addiction to Diet Coke.
Wow.
Now, the train of thought was, well, it's diet, so it's got no sugar in it, but actually the acid did the damage. Now, he was drinking 12 cans per day.
Whoa.
Which is not good for your health in general, let alone your oral health. So that was a full mouth clearance and dentures, and he wasn't old either. He was a gentleman, in the middle of his life, we'll say. That was, as I say, quite early on in my career. I probably had only been dental nursing probably 6 months to a year, I would guess, and I was just like, whoa, this is something else. And then the other one that really sticks in my mind was a patient, and a female patient, and she walked into the room, and I can remember the dentist saying to her, and obviously he wouldn't get away with this now probably, but he commented on her weight. He said to her, wow, you look great, you've lost so much weight. And she said, oh, thank you, I've been, a certain slimming provider's dieter of the year, this kind of thing. And he said, oh, wow, how have you done it? And she said, oh, I've just fallen in love with fruit. I love fruit. I eat fruit all the time. It's like my thing now. I'm doing much more than the 5 recommended portions a day. And she opened her mouth, and her mouth had been ruined with the acid. She was addicted to satsumas. You said that you had a little satsuma.
Satsuma addict. So there tells the tale. Okay.
And just the constant acid attack of the satsuma, of continual consumption of. I mean, I can't even remember how many she was eating a day, but it was obscene. Had done her figure the world of good, but her mouth was suffering as a result. And I have seen some pretty dirty mouths, shall we just say, where people don't necessarily keep up with their oral hygiene, and then we're having to remove calculus, so big plaque deposits that are like literally stuck to the teeth, quite thick, and we're getting tools out to remove those. And basically, if you don't brush twice a day, and if you don't look after your teeth interdentally, and that is just as important, you're going to see this spread of hard calculus, of hard plaque building on the teeth. And if you don't get it under control, you're going to end up having problems from that as well.
Oh, that's fascinating. And I'm writing my notes around snacks and thinking about sugar content and things, and obviously getting that appointment with the dentist if we can get there, if we can find a dentist that we can see. There will be some people listening whose children, either because of stimulus or environment, or learning difficulty, or just nerves or anxiety, find the noise or going to the dentist. It could be the same for adults as well listening.
Absolutely.
What can you do? One, if we need to get our kids to the dentist, what can you ask the surgery to do? What would you do as a dental nurse to make sure that somebody can get through their appointment and that they are as relaxed as possible?
Obviously, taking that first step and getting them to the practice is generally the hardest bit.
Sure.
I've worked with patients over the year that we've had to do it in stages. So they've phoned up, they've said, I'm really, really anxious. Can I just come and sit in your waiting room? And they've done that for a few days in a row, just come in, sit and sat in the waiting room for however long they needed to start getting used to. And let's face it, surgery smell. We're working with high levels of cross-infection and chemicals and things, so it's got a certain smell to it. And sometimes that can put people off. But yeah, I've worked with a patient once, and we just literally, she came in and she started off, she'd literally just get in the door and then she'd be gone. And then she'd come in a little bit further, and we built it up like that. So, practices will always work with anxious patients. Children in particular, we do find that quite often the phobia is learned. So It has come from a phobic parent, or perhaps something like having these full clearances when they're young. That's quite obviously traumatic and enough to put them off later on. If it's a sensory thing, if it's quite noise, they don't like the noise, and let's face it, the drill makes a lot of noise. Ear defenders, absolutely fine in the surgery as long as we can move around and get to where we need to be. I've had patients come in with their own music on an iPod or an iPhone or something like that, and just sit with that in. We've had patients use hypnotherapy. One of the practices I used to work in used to have a DVD player and a screen above the seat. So with kids, we'd just put on an episode of something they wanted to watch and that kind of thing, and it was really helpful. But it is all about that communication, having communication with the dental team and finding out, trying to find out exactly what the issue is obviously important, and then trying to deal with that. As a last resort, medication can be given, but that is really kind of like a last resort if we have to.
Okay, I've got a final question for you, and this is about alignment of teeth. So some of us with children or adults as well, where teeth are perhaps growing or have developed slightly wonky, overlapped, etc. What's your best route to talk to the dentist about dentistry, orthodontics, that sort of thing?
First of all, don't panic. Okay. When baby teeth come through, they might come through all in funny orders, and then they end up on top of each other, and we end up with crossovers. The bite might not be quite right. We encourage parents, yes, obviously, if you've got concerns, please come and see us. Come to a surgery and ask the questions you need to ask to be reassured. But generally, with the teeth in children, we know that they're still growing. Okay. And that includes the jaw. The jaw has to grow as well to accommodate, especially as we get older and we get more permanent teeth. Obviously, there are more permanent teeth than there are baby teeth, so we've got to make room for those. And as the jaw grows, everything should kind of even out a bit. So with baby teeth, we don't worry too much, because they might all be in a funny order or upside down almost, back to front. It's how those adult teeth come through that then we'll start having a look at. So Don't panic too much if they're young and you feel like this isn't quite right. Obviously get checked, but don't panic too much. As the adult teeth come through and the baby teeth move out, we still see some moving around of stuff. Quite often we might end up with a gap in the front teeth, a diastema. We end up with canines, so our pointy sharp teeth, vampire teeth, further up here because perhaps something hasn't moved out the way to allow them in, or the jaw's not expanded enough yet. And it all comes down to time. So any concerns, please do visit your dentist and ask. But generally, decisions are not made until the baby teeth are all gone. We're at that point where the jaw has expanded enough to allow the space and we can see what we're left to work with. We spoke about the NHS and how the NHS system for dentistry is under pressure. A lot of orthodontic treatment has changed in NHS now. It used to be that basically you would get orthodontic treatment regardless of how many teeth were out of alignment, what the situation was now. Now they look at the need, the necessity. So if the teeth are out of alignment and it's deemed more cosmetic than it is actually a necessary component to like eating or that kind of thing, you may not receive NHS orthodontic treatment, but you can still follow the private route.
Brilliant. Thank you. That's really interesting. So many things for me to take away and for our listeners to take away. I've got a final question for you, Marisa. What would you want from families listening to you talk today as a practicing dental nurse? What would you want people to take away from what we've discussed today?
I want people to know that we do understand that it's difficult at the moment to access NHS dentistry, but please do make your oral health in general a priority and chase down those private dentists if you can. We only get, like you said earlier, we only get this set once our permanent teeth are through. That's it, and if we start ending up in situations where teeth are perhaps being extracted and we end up with gaps and things like that, we can run into a lot more trouble. So it is really important that we understand what is expected from us in the kind of home environment to be looking after our oral health. So what we eat, what we drink, how often we do that, and then the care on top of that, the toothbrushing, the interdental cleaning, mouthwashes. We didn't talk about that earlier, but a good fluoride mouthwash never goes amiss as well. But also do make sure that where possible you do get to a dentist, because not only are we talking about teeth, we're talking about the gums, and as we said earlier, those early detection for oral cancers and things like that, especially in adult population that might be smoking, alcohol related and such things as well.
Marisa, thank you. It's been really insightful today. Thank you so much for joining us. Thank you to our listeners for listening to our Family Health podcast today. If you would like to subscribe to the podcast, please do so via either our social channels or from your chosen podcast provider. If you want to watch the podcast, if you want me to see me grinning my teeth over at Marisa while she's been doing a quick exam over the airwaves, if you want to watch the video of this podcast, you can do that via our YouTube channel, Family Health by Mini First Aid. And if there are topics that you would like to hear about in the future, if there is a particular family health subject that you would like to know more about, please don't hesitate to get in touch, because we'd love to cover all the topics that you are most interested to hear. You've been listening to Family Health by Mini First Aid. Thank you so much for listening. Thank you for listening to Family Health by Mini First Aid. I hope you found our podcast really useful and informative. If you want to know more about Mini First Aid classes, courses, qualification courses or first aid supplies, please do visit minifirstaid.co.uk or look us up on all your favourite social platforms at Mini First Aid. As you care for your family's well-being, remember that Unity Mutual believes in enriching lives beyond pounds and pence and is here to support both their health and financial future. Choose Unity Mutual for your junior ISA and you'll not only invest in their dreams but also receive a free mini first aid class. Thanks to Unity Mutual for making it all possible. Until next time, stay informed and financially secure, knowing that your journey with Unity Mutual is about more than just money. It's about nurturing your future and protecting your loved ones. every step of the way.